Act with audacity. A woman said that nearly 200 years ago. And in an era when women couldn't even open up a bank account, she went on to build one of the most enduring brands in history. If Madame Clicquot were alive today, I think we can all agree that she'd be a Marble member. And one day soon, we do hope to honor her legacy inside Marble alongside women leaders of today. Tonight, the room is full of women who are going first in their own industries and in their own ways. And the next conversation focuses on something that sits at the center of it all, our health. Research for Harvard Business Review and MIT found that the average age of the most successful startup founders in America, it wasn't 25, it was 45. Women in their 40s and 50s are often in their most powerful leadership years, building companies, leading organizations, and stewarding capital. And yet, at this moment, when women's health has become more complex and is historically the underfunded and the least studied. And yet, this is also the moment where our health is not a luxury. It's one of the most important investments that we can make in ourselves, for our homes, for our families, and for our work. The women joining the stage tonight are helping lead that change. Our moderator tonight is Teresa Sexton. She's managing partner at Claritas Capital, who brings an investor's perspective to the intersection of health, innovation, and capital. She's joined by Delphine O'Rourke, the CEO of Dotted, and a leading voice on the regulatory and M&A forces shaping women's health and longevity. Dr. Fahimeh Sasan is founding physician and chief innovation officer of Kindbody. It's a rapidly growing fertility and women's healthcare platform, expanding access to modern reproductive care through tech-enabled clinics. And Dr. Sophia Yen, who's the co-founder and CEO of Pandia Health. It's a digital platform using personalized data to help women find the safest and most effective hormone care. Please join me to the stage.
Thank you. Hi, everyone. I'm Teresa Sexton. Can you hear me okay? I'm doing a little mic check here. Thank you, Kristen. Thank you, Marble Collective. Thank you to the very, very generous sponsors that we have that bring us to this room today. I am so honored to be on this stage with women that have audacity and they're shameless about it, and I'm so appreciative. Everything that they're doing is disruptive, and I'll tell you, it's pulling women forward, right? Is so imperative. It's Delphine having a call with me. Can you be in this room? It's then me saying, I think Fahimeh would be a great person to be in this room. It's Kristen saying Sophia Yen has to be in this room. So that's what we have to do in our pursuit to be audacious, I guess. So we're talking about hormones. We're talking about women, wealth, and health tonight. And we're going to start with Dr. Sophia Yen, who has spent 30 years really committed to women's health, all seasons of women's health. There's confusions about hormones and perimenopause. But let's be honest, there's never been another time where more women have really said, what is happening to me? Somebody has to help me fix it. I'm not just going to deal with it. I'm having a hot flash. I'm kind of having one right now. I can't sleep. I have brain fog. I'm also a high earning person in my household, if not the person in the household. I'm managing a family. I'm taking care of my parents. So what are some how do we deal with it? So give us some tips on how to deal with it. Share with us your 30 years of research and commitment to this space.
Yes. So I love how you led with women of our generation, our genre, are tired of, I'm all about hashtag stop sucking it up. So if you have brain fog, you have hot flashes, you have night sweats, you have genitourinary syndrome, which is painful relations, or our desert vagina, as I like to call it, or risk for osteoporosis, then you qualify for HRT, bioidentical estrogen and progesterone, not synonymous with compounded. There are FDA-tested, FDA-approved options that you can have. And then if you're in perimenopause, which is chaos, there's roller coaster of hormone, there's estrogen egg popping out when it shouldn't pop out, and another egg, and so the estrogen stacks up. HRT is not the answer. So we've educated a lot of women probably in this room that HRT is the answer for when your ovary's like, I'm out of here, no more for you. Yes, put the estrogen and progesterone back. But in its last throes, where it's like, then you want to flatten that by using the birth control pill or birth control ring and make it smooth. Or you can do a progesterone-only pill and skip the placebo as well. So my company, being a woman of color, being from UCSF, Stanford, and MIT, and having a love of spreadsheets, I took all 40 different birth control pills and ranked them. Most likely make you bleed, least likely make you bleed. Most likely give you munchies, least likely give you munchies. Most likely give you zits, least likely give you zits. Yes. Exactly. And so for only $35 once a year, you can use Pandia Health's expert services for birth control. For menopause, a little more because you have more and take more of our physicians' time, so that obviously will cost you more. But that algorithm, realizing that at the top medical schools, we teach everybody, this is how we teach people. Here's the pill your professor likes. And if that doesn't work, find a backup. Good luck with that. But how about we use Dr. Yen's spreadsheet and see what the issue is and then customize it? Because we were seeing people of Asian and Black descent having a particular side effect. And so I came up with the spreadsheet. I fixed it for the side effect we were seeing in people of Asian and Black and Latina descent, people who want to make hashtag periods optional. And as an aside, periods optional is my TEDx talk and gift to the world. Anyone who's bleeding every single month, that is so 2020. Get with the times. We have drugs and science. You don't have to have random blood 1 week out of 4. And it's actually more natural to bleed not as many times. When you decrease the number of times you bleed, you decrease your risk of ovarian, endometrial, colorectal cancer, anemia. It's also good for your skin. So anyway, with the algorithm, we have 93% of our patients happy with the first pill prescribed. So none of this guinea pig test trial, figure it out. We do a follow-up with all of our patients at 10 weeks. You good? Breakthrough bleeding, headaches, zits, munchies, you want change? 93% of our patients are like, let's go. And then more importantly, the gold standard, how many people that are new to the pill are still on it at a year? We have 82% that are still on it at a year. The standard is 33%. So it's huge, the difference between picking the right pill with no side effects and delivering it to your door also does a great thing. And that was the whole reason I started Pandia Health, was no one runs out of birth control in our watch. But then on the menopause side, learning as a physician that had been gaslit myself. So I was on constant hormones, so I didn't have hot flashes. I didn't have night sweats going into menopause. And so the treatment for perimenopause is flatten that sucker out. Don't have those drops that are causing the hot flashes and the night sweats. But this doesn't cover the other parts. In the way that I knew I hit menopause in reverse, I went to my doctor. My waist disappeared. My cholesterol shot up. Last year, totally normal. This year, off the chart. And none of my pants fit. I go see my doctor. She puts her hand on my shoulder, and she goes, that's just old age. You need to exercise, and you need to eat better. And little does she know, I'm an obesity expert at Stanford. People wait 6 months to see me. I tell them how to diet. I tell them how to exercise. And you're telling me how to diet and exercise? Like, Certainly we are moving to more protein, 60 grams of protein a day. Certainly we are moving to building our muscle to pull on our bones for osteoporosis. But when I became one of the few Menopause Society certified practitioners, there's only 4,100 in all of North America for the 1 million women that are entering menopause each year. Then I realized old age is sometimes a euphemism for menopause, that when you take away the estrogen, everything goes to poo. And so you put it right back. And as I like to say, estrogen affects every cell from your head to your toe. And dry hair, hair loss, dry skin, dry eyes. My husband's like, dry everything. And I was like, yes, dry. I'm getting like bruises and rips and dry everything down there too. And so if at the very least, if there's a contraindication to estrogen or whatever, urogynecologist, so not a urologist, but a gynecologist, urogynecologist, super specialized people have said everybody 52 and up should just throw down some vaginal estrogen. Because again, when you take away the estrogen, it all dries up, and right above your vagina is your urethra. So it increases your risk of urinary tract infections, urosepsis, and particularly I'd say at least starting at 60, because I've seen it in 70-year-old women, family member as well as friends' parents, that they have recurrent urinary tract infections. And I told this one nursing home for this guy's mom, I think I cured the whole nursing home of their UTIs. So those are some tips.
I love that. They probably need you at the villages in Florida. But I need to call out Dr. Sophia Yen's purse, which is covered in condoms. So I know Dr. Fahimeh Sasan, I know Delphine, but I didn't know Sophia. So I just really binged on a lot of her YouTube videos that were out there, and she said, I'm probably the only CEO that that has a uterus around her neck, and I carry a condom bag, and I have a beaver ring. And so I think the condom bag should be a swag bag for any other event that is. And so, but just before we go to Fahimeh, what do you think is the one thing we're not talking about in a room like this, or even in our own close community, girls with wine, women with wine, when we're hanging out, having lunch with our friends? Like, what is one thing we should be talking about seriously about aging?
Yes.
And
I think that we need to talk periods. We need to talk menopause. We need to talk perimenopause. Like, just like you might be like, oh, I love your hair. Where do you get it cut? Or what's the latest Korean sunblock, which I love? Are you on HRT? Which one are you on? Are we doing testosterone? Are we not doing testosterone? We're all talking GLP-1s, but we need to talk this. And we need to talk this with our children. Know that 50% of your menopause risk is associated with your mom. And the other 50% is probably with your dad's family. So you want to ask your auntie, you want to ask your grandma, you want to make sure you get that information. Family history is so important as a risk factor. The other risk factors are smoking and then stress in your life. And of course, as sandwich generation, we're all stressed out of our minds. So it's like, thanks, yeah, I know I got to deal with stress. But stress is just part of life. But we should talk periods, we should talk menopause, we should talk birth control, and we should fund women, and we should fund women's health. And I don't understand why they say it's a niche when it affects 51% of the population. 100% of us are going to go through menopause.
That's right. That's right. Now that's the biology piece of it, but now we're going to talk about the access, and I want to introduce you to Dr. Fahimeh Sasan, who is a practicing OBGYN. She's also a chief medical liaison to some of the largest employers in the United States about fertility benefits. She also leads innovation for Kindbody and talks to companies about how they can lean in and be a leader in unlocking some of this access. So, you were really instrumental in launching an exclusive partnership with one of our largest employers in the country, Walmart. And Walmart's not known to be Upper East Side people. They are not, it's the middle of the country. It keeps our country going, right? It's 1 million workers that they employ, and they realize fertility can't be reserved for just the 2%, the high earners. We need Walmart babies. We need people running this country in the next 20 years that are willing to drive the trucks, stock the shelves, and check people out or do what they do, right? So I'd love to hear a little bit about the discovery, the initiative, and take us through that journey about introducing the concept of access to women's health and how they can be a supporter of that and building families. Tell us more.
Yeah, thanks for having me. That rain was pretty incredible, right? It seems to have dwindled down. Thanks for having us. By the way, I loved your talk, and I think it's so incredible that you're like such a passionate historian. It was awesome. Okay, so before I get into Walmart and all of those things, it's really imperative for all of us as women sitting here in 2026. Like we just heard about this incredible historian and this widowed woman making champagne when she couldn't even have a checkbook. But then fast forward and we're in 2026, and the United States, when it comes to women, we rank 33 out of 38 in high-income countries when it comes to the lowest life expectancy for women. We have the highest maternal mortality rates in the world when it comes to other high-income countries. African American women today, even in New York City, where there's more hospitals than there are Starbucks, or just as much, African American women are 3 times more likely to die in childbirth than their white counterpart. We're talking about that women, think about it. So everybody gets like a little bit mental joke, like, oh, 80-year-old woman dies. But we're talking about women die in childbirth. When you think about the average reproductive age, we're talking about women dying in childbirth in their teens to 40s, which should be the prime of our lives, doing the most simplistic thing that's been happening since the beginning of time, which is having a baby. And these are things that are happening today. So when we talk about changing the face of healthcare, if we're waiting for the government, we're all going to die. If we're waiting for insurance companies, nothing will change. And so there's this unique opportunity with self-insured employers. And if you don't know what self-insured employers is, more and more large employers are saying, hold on, we're spending so much money on healthcare that we're going to become self-insured. We're willing to pay the dime. We'll make the decisions. We're not going to go through the insurance companies. We're going to make our own decisions on our healthcare expenditure because it's one of our biggest expenses. Why? Because in the United States, we provide sick care. We do not provide health care, right? So now here's Walmart. Walmart actually, and most people are very surprised, Walmart is the largest employer in the world. It used to be the Chinese Liberation Army, but Walmart beat them. So now it's Walmart. You can chat GPT me and check it out. So Walmart is the largest employer in the world. They have 1.7 million employees in the United States alone, all coming again from a beautiful history of Sam Walton and all of that. If you maybe next time you could tell us about the Walton family, it's actually quite incredible. But Walmart has a really interesting approach. So Walmart has centers of excellence programs. Why? Because they realize that they have members in every little town in America. There are towns that exist that are not only reproductive deserts where people don't have access to birth control. And by the way, did you guys know that 49% of counties in the United States don't have even one OBGYN? Right? And so here's Walmart, right? They have people in all of those counties. And so their Center of Excellence model is actually really unique. And the 2 aspects of it. Number 1, they would rather pay for people to travel and put them up in a hotel for fertility through us, for MSK, musculoskeletal surgeries, for obesity surgeries, for cancer procedures, for heart transplant, than to leave it to you to figure it out and get paid through your insurance. And so by having the Center of Excellence model, not only are they controlling their cost, why? Because they have 1.7 million employees, so they can negotiate, but they're also ensuring that their people, even the ones that come from these podunk little towns that have 1,000 people with horrible health literacy and low socioeconomic conditions, will get to the Mayo Clinic when they need that heart transplant and have the best care for the first time. What does that do? Sure, I just spent a lot of money getting you there, flying you, paying your hotel, but I know that your care will be right from the start. And that's really genius if you think about it, right? And so when we approached Walmart, Walmart did not have any fertility benefits, nothing. They didn't offer anything, not insemination. They just didn't have fertility benefits, which, if you think about it, wasn't that strange. Fertility historically was a nice to have. It wasn't a mandate. But in 2022, when we partnered with them, it was starting to be a must-have. Why? Amazon had fertility benefits. Starbucks had fertility benefits. And they're competing for the same talent, right? Walmart employees are warehouse, they're truck drivers, they deliver all of the things. So when you're competing for the same talent, you have to have benefits. And so that's where it's like all of a sudden their healthcare benefits are a talent acquisition retention tool. So that's actually why. It's not that, I mean, one would love to think it was out of altruism, but seriously, it was a talent acquisition retention play. And so when we met with them, we said, great, you have 1.7 million employees. Fertility is expensive. We will partner with you through our clinics, and we have a footprint of 26 fertility clinics across the country. We'll give you an exclusive deal that I guarantee you can't get if you went a la carte to each of the fertility clinics. And what we will do is serve your people with a travel benefit. And so we're now 3 years into the program. As a result of this program, truck drivers, cashiers, so we're talking about hourly employees that I guarantee you would have never been able to afford the ability to have children. We now have hundreds. I think if you add the people that are pregnant, there's close to almost 1,000 babies that have either been born or will be born that are due to this partnership. And the thank you. And the access to care perspective is huge, because I meet a lot of these patients. And if it wasn't for this benefit, they would continue to be having miscarriages. They would continue to be mismanaged, and they would never be able to realize, their dreams of having a family.
Well, thank you for that. And I have to say, Kindbody is the second fertility clinic to be stood up in the whole state of Arkansas. The commitment to building families, but beyond that, has over 100 employer relationships. So tell us what's table stakes. If a woman in here is leading a company, is on the board, or if she influences benefits, what are the table stakes in fertility or family planning, that you really need to consider?
Sure. So it used to be, we're all pretty used to it. It used to be your employer offered you major medical, vision, and dental. That was, and maybe you had a 401k, and that was it. Now it's standard that you have to have reproductive benefits, and fertility is included, pregnancy support, taken to maternity leave, paternity leave, menopause programs, covering HRT. All of those things are now becoming very standard. It's like the fourth benefit. So we have major medical, vision, dental, and we have to have reproductive benefits, which, by the way, has to include male fertility benefits too. Low testosterone, semen analysis, all of those things, because male fertility, actually 2/3 of the time, the male is either the sole reason or a combined reason. So having those benefits not only becomes a table stakes, but ensuring that people have access to them. Because again, if you think about it, Walmart could have added fertility benefits. They could have said, sure, as of today, we cover it. But without a partnership like ours, or without creating some sort of a travel program, their people wouldn't have had access. You would have just created kind of a carrot without a stick, And so I think that's the most important part, is as people develop benefits, one of my biggest pet peeves is I think a lot of benefits check a box, but don't actually go down to ensure that the end user, which is the patient, is actually getting a good service. So like right now, menopause is a really hot topic. Everybody's covering new menopause programs, but unless it's actually able to treat, right, diagnose, manage, and treat you, then it's failing, right? And so that's where I love the fact that you have your spreadsheet. You're also doing the medication delivery. You have to do the consultation. And so I think when it comes to any benefit is what is the actual end user, because there are so many point solutions right now. I do not envy a benefits person because they all start looking the same. And I think there's a lot of misconceptions. And so really looking at what the end user experience is key.
Okay, thank you. And before we get to Delphine, which we're going to wrap up with her, I want to go back to Sophia about, going beyond building the family. A lot of us are in our 40s and 50s. We talked about these are the women that are building companies. They're the most successful CEOs right now. But can we go back to HRT, hormone replacement therapy? There's been a lot of discussion on the label warnings, and talk to us about what science is revealing related to that.
So I want to give you guys 2 tips. This is how you test if your physician knows their menopause. You go to the physician and you go, what's the latest on menopause treatment? And if they're like the lowest amount of hormone for the shortest amount of time, that was 20, 30 years ago, okay? And then you say, how long can I stay on my HRT? And if they're like 10 years, otherwise stuff. And you're like, wrong answer. So even if some people have, quote, missed the boat, there is now this critical time hypothesis that menopause happens here and you got to throw on that HRT before 10 years. And so I come from MIT with a biology major, so let me explain it to you. When you take away the estrogen, your arteries no longer dilate. They fill up with LDL and triglycerides. And if you let that happen for 10 years, imagine this artery filling up with LDL and triglycerides. And then 10 years later, you throw down estrogen, which causes blood clots. Is this a good thing? No, because, no. And so, but if you're healthy, you don't have high blood pressure, you have a negative CT cardiac scan, so everybody should be getting one of those if you have a family history of cardiac disease, which most of us are going to die of unless we're crazy healthy and on statins and on estrogen, then you should get one. And if that's clear and you don't have high blood pressure, then it's shared decision making that you could start HRT. And as I like to say, HRT helps your blood, brain, and bones. However, the blood is not currently an indication. I don't know when we're going to have enough research to justify it, but they are saying if you start it within 10 years of menopause, it's not bad for your heart, but the mechanism is obvious. If I can dilate my vessel and I can decrease my triglycerides and LDL, that will prevent death and disease. But those are 2 questions you can ask your physician to see if they know what they know. And then the difference between a doctor-founded, doctor-led company and a not doctor-founded, doctor-led, and an academic one is I couldn't just sit there and write prescriptions and watch women suffer from side effects. So I had to study it and make it better. And that's the difference between an academic physician who's looking at the numbers and like, how do I make this better for women? And so we are the only company that has an algorithm for picking the best birth control pill. And as I mentioned, it's quite affordable to use our services.
That's really good to know, especially if you have preteens, right? Or young women coming of age.
And hashtag periods optional. So go to pandiahealth.com /periods optional or Google Sophia Yen TEDx talk. It really is my thing because there's so many people working on anemia. The number 1 cause of anemia in a menstruating woman, menstruation. You cut down the bleeding, it's bloodletting. I tell people without uteruses, take a knife and go in 1 week out of 4, right?
Yeah,
1 week out of 4. But,
true.
and then as an aside, because Olympics, Amber Glenn was like, my period. And I was like, who is your doctor?
Exactly.
Who is your doctor? Because if it were me, there's no way you would be bleeding anywhere near the Olympics.
Yeah.
I would have turned that off. I would have pre-bled you the week before if
Yeah.
you really like to bleed. But like, no. And so we're talking with the NCAA in basketball about making this a consideration. There's so many people with apps and they're like, let's sync and seed cycle. No, just turn it off.
Yeah. I love that. Okay. So we talked about the body. We talked about family building. We talked about access, but none of this really exists without capital. And there's not enough of that, just so you know. And regulation and really power struggles that we're seeing every day. And this is really where the leverage sits. So we're going to talk to Delphine O'Rourke, who has been a powerhouse in the women's health industry. She was a leader and a lawyer in one of the largest health systems in the country. And then she went to Goodwin, where she did groundbreaking things and leading women's health practices. And then she decided to take it upon herself to, which I love, to give back. And I think it's a give back. And now she's really mentoring, teaching, encouraging, empowering the next level of attorneys, of practitioners, of business professionals, as a professor at Columbia Law. As if that's not enough, then she was an investor in one of the largest or most active investment platforms for women's health called Portfolio, and then decided just recently to launch a very exciting new podcast. So I will have 5 other things that Delphine will do next year. I will add to that, I'm sure. But she's also the founder of a company, Dotted. So if you are a business owner, if you know a business owner, Delphine is providing M&A expertise and guiding founders and others in this ecosystem and navigating what is becoming a pretty challenging environment. So Delphine, from a regulatory and legal standpoint, what is really happening right now? And let's just get candid. And how should the women in this room really try to navigate safely this environment?
Thank you for that question. Can you hear me? It seems like the rain has come back up. Before I jump into that, I'd be remiss if I'd introduce my co-host on the Conversation Lounge, Lorraine Pendleton, who's up in that back corner. We just launched about a month and a half ago, and part of our thesis is to have conversations like this one. So thank you, the Marble Collective, and really elevate the conversation around important issues with a business investment lens. So thank you. And then Philippa Portnoy, because what I do is connect the dots, launched Launch Break 2 years ago, the first community for women athletes, and you guys need to connect, because you're going to transform all the athletes and whether they're having a period or not. So thank you for that. So, I'm going to focus on certain areas that we've touched on tonight, because we could have a whole day on the regulatory changes and the environment in this current administration compared to the other administration and what we see coming down the pike. So I'll just touch on a couple issues. The first one is you talked about, and so did you, the HRT in the black box. There was a reference to the removal of the black box. Does this sound familiar to anybody? When the FDA said we didn't really need the black box warning anymore on vaginal creams? Yes? No? Okay. If not, look it up. Why is this key? Because this is, in my opinion, this is the administration saying, what's an area that is non-controversial? And I was advising clients before this administration came, they said, what are they going to focus on? And we're taking abortion, putting it over here for now, because that is very controversial. So the administration said, what can we focus on that's not? And menopause, and I said menopause is going to be a big one, because at least so far, it's not political. Maybe it will be, we can't predict, but it's not like vaccines, it's not maternal health. Maternal health is very political. Obviously, reproductive rights, we can touch on IVF, but menopause is pretty neutral, so they're going to lean into that one, and that's what they did. And the FDA commissioner, Markey, they did this event. A woman who's now the head of HRT, who many of us who are in women's health know, Dr. Alicia Jackson, she started a menopause company called EverNow. They said, let's really lean into this and make this like an event. And it was incredibly successful as a nonpartisan, at least tried to be. We are for women too, and we're gonna lean into this menopause issue. So I would predict that next week there's a big conference, Health and Human Services on Women's Health. It's the first inaugural conference, and that there will be an announcement again around menopause. As we've talked about, menopause impacts every woman. Every woman will go through menopause unless she dies of something earlier. And I've been pitching menopause investment to private equity, to VC for 6-7 years now. And when I started, I would get this look, particularly since it was all men, like, A, what is it? And B, I can't believe you're even saying it. One of my senior partners once said to me, I can't believe you said that. And C, why the hell would we invest in it? What people have realized, not just investors, but marketers, fill in the blank, is it is a marketing play. How do you get to every woman through menopause? And then you start looking at behavioral habits, whether it's buying your coffee at Starbucks, or whether it's what car you're going to buy, or how you're going to retire, plan for your financial investment. Menopause, it happens to all of us. Doesn't matter what the socioeconomic background is, the race, etc. It happens to everybody. So there's really been a shift. So see more regulation, liberating regulation around menopause. I don't expect that we're going to see much on maternal health. We have Medicaid cuts coming down the pike. About 48%, and tell me if you've heard this, and I know that, Alessandra Henderson, who started Electra, I can't see with the lights. Menopause, where is she? Wave, there she is. She's another original gangster. I think Michelle Jacobs is still in the room, started Woman S. You know these statistics, about 48% of babies born in the United States, that delivery is paid for by Medicaid. Raise your hand if you knew that statistic.
I thought it was more, but yes.
48%, okay? So when we're talking about these, quote, Medicaid cuts, and it's like one of those words that's like, what does that even mean? It sort of sounds so, we can talk about access, but it's become so like desensitized. That means that 48% of moms delivering babies and 48% of American babies will have their health care benefits, which are already not great, cut. This is an issue when we talk about what we can do in this room is shine a light on that. Shine a light on that. This is not thank you, please clap. We say we want babies to come in. We need, population expansion. Okay, great. How about the babies who are already going to be coming into this world? What kind of healthcare are they going to be receiving? What kind of access? You touched on access. Access isn't just about having it paid, but if you have to drive 3 hours to go see an OB, and you're working a job that does not afford that luxury, you're not going to get that prenatal care. So menopause, maternal health. I'll touch briefly on censorship. There's too much censorship. That's one of the reasons that the Marble Collective is phenomenal, is that whether you're using LinkedIn or other social media platform, the algorithms are censoring information about women's health. I have a client who was censored because their product is a breast pump, and it was censored as being pornographic, okay? Okay, we don't even have to spend too much time on that. Okay, censorship at so many different levels. Okay, this is something that, again, we can all push back on and say, why is this happening? I'll touch on IVF because President Trump came in saying, I am the father of IVF. There was an order in February, an executive order, which is when the president just says, this is what we're going to do. And there was supposed to be a response and a very concrete plan around IVF. Months passed. We eventually did have an announcement. And the main, without going into the granular, we don't have time, or that one, there would be a path, and this is important for everything that Kindbody does, is for employers to have a path, that doesn't mean that it's a mandate, to offer fertility benefits. So it's just saying that there's a mechanism, just like eyes or dental, for fertility. It is not a mandate. However, if you're in a position of power in an employer environment, you can say, we want it to be a mandate, and reach out to Kindbody and other providers of services. We don't have to wait for the government to say it is required. The second piece on IVF, which hopefully will help democratize, is this concept of Trump RX. And there's tremendous markup on IVF drugs, and that women could go ahead and buy their own drugs. So that could be a positive in theory if it actually happens. The, I think, less positive thing is that some of the laws that have said, oh, we're going to expand IVF access or coverage are actually limiting who can have access to IVF to same-sex married couples. Now, it's not, so again, an area where it says, oh, this is all great, but when you sort of dig in, there's a lot more there.
Yeah. There is so much more to talk about. Delphine will meet with you. Let's talk after. I know we got to go. We got another great panel right after us. Dr. Sophia Yen, thank you so much. Pandia Health. Delphine O'Rourke with Dotted and everything else, and the Conversation Lounge.
Conversation Lounge.
Yes, and Fahimeh Sasan with Kindbody. Thank you for your audacity. Thank you. Thank you, Marble Collective. Thank you.